right, we'll go ahead and get started. So thank you guys for coming. Really appreciate sticking it out through the end of the day. So this is Personal Community and your digital front door. So my name is Meredith Staszak. I am the product manager for patient experience here at InterSystems. And so what we're going to cover today, well, I like to start with kind of an overarching level setting on what I consider a digital front door. So we'll talk a little bit about some strategies, what that means to me and how that kind of drives our application forward. And then have a series of demos to kind of show you the application as it stands today. And I'll spend some time kind of calling out what has changed since last Global Summit. And then, should time permit, we'll get to the end of this and I'll talk a little bit about where we're going, really a little bit of strategy around how we've outlined our feature set for 2024. I will very, very briefly touch on AI because how can I not today? And we'll just kind of go from there. So I like to start by using Gartner's definition of a digital front door. And they define it as the primary point of digital engagement and digital interactions with consumers, consisting of an omni-channel communication platform and used to provide multiple stakeholder groups centralized access to digital and analog products and services. And so I like to break this up really into three key areas for conversation. So the first is this concept of it being a primary point of digital interaction. So what we're really talking about here is building a comprehensive entryway for your organization. So it can be, one point in that lets you connect to a whole series of applications and services that you're going to provide your patients. It can just be one larger application for all of that. But the key thing is really providing that single point of entry for patients and people to interact with you. The second is this concept of an omni-channel communications platform. And so for me, this really takes kind of two forms, or at least in my understanding of it. So the first is ensuring that you're building something that's going to leverage all of the ways that we can communicate with people. So that's talking about ensuring that you're providing services over a web app, mobile app, but still continuing to leverage things such as phone calls, in-person interaction, text messages, et cetera. So I like to kind of take that and use that to then continue to remind people that everyone that you interact with is still going to have a preference in their form of interaction. So while you're thinking about your strategy and the kinds of functionalities that you're putting into your digital front door, ensuring that these services are available across the platform. So if I'm on your mobile application, I should be able to perform the same set of services if I pick up the phone. So if you compare me and my mother, she's going to pick up the phone and call you for literally everything, and I'm going to avoid that at all costs. But we both should be able to do the same things, booking our own appointments, asking questions, et cetera. The third is a little bit of a shift in the last couple years where we're starting to talk about multiple stakeholder groups. So I think all of us, when we first started on kind of a digital patient journey and engagement, we're really focused on services that we provide a patient at a particular point in their care. And what we're starting to see now is looking at how these services extend to family members, care teams, really anyone else that's in a person's ecosphere in their lifetime. And so that's kind of where Gartner leaves us. I think it does a good job kind of setting up that concept of a single point of entry for any person to interact with you as an organization. But it doesn't really do anything with the last sentence, which is the types of services that you're looking to provide people. And so for that, I like to flip to a survey that KLAS did. Not so much for the survey results, though it is interesting to see how the providers define a digital front door, but because I think it does a very good job with the visual shift that also occurred a couple years ago. So our movement from I am building something to interact with you, patient, at this point in time, to I am building something for you, person, across your lifestyle. So if you're starting to look at a person and all the ways that they might interact with you and when they might interact with you, we can oversimplify this into kind of 4 key points of interaction. So the first is really that pre-acquisition. So before a person becomes a patient, how do they learn about you? And I would somewhat agree with the providers here. I think this potentially is not necessarily your digital front door, but it's the series of services that drive someone to it. Very simple things. If I move somewhere and I start looking for pediatricians, where does your organization come up in my Google search results? What marketing campaigns are you doing? General outreach, that would get someone to find your organization and start interacting with you. And then you can start kind of expanding on there to look at the types of services that you might provide someone before they're a patient. I know some sites that do allow you to book your own appointments, pre-register yourself before you actually exist within the ecosphere of the hospital or facility. I'm not clinical, so I will routinely say things slightly wrong in that case. Then we move into the second bucket, and everyone knows and loves this space. This is where we as portal vendors have been for years. So this is you, we know you are a patient at our facility. What are the types of services we provide for you when you're looking to obtain care? I can book my appointment, I can find providers, maybe I'm interacting with my providers. It's kind of that core portal plus set of functionality that we've been growing for the last few years. Third here, you're continuing on your journey. You're now within the walls of the organization. And I think this is an interesting one, and you'll see that providers also don't think of this as the digital front door, and it may not be, but there are certainly points for digital touch points and interactions within the walls of your facility. Simple things like I arrive, I have a wayfinding. I know how to get through your facility. I can get from point A to point B. I'm approaching something like I need to go get labs. Digital wait times is another nice way to kind of let somebody know what's going on. You can take this further. I like to think about, hopefully some of this has changed over the years, but about 10 years ago, my mom was having surgery for a brain tumor. And so we spent the whole day in the hospital, not hearing anything. Her surgery ran 3 hours over. And I think we had kind of 2 check-ins. So for me, I think trying to understand, again, expanding that definition to multiple stakeholder groups, what could be done to help families in that scenarios? Like my dad spent 7 hours in a room because he was scared to leave. And I think there's room in this space for us to grow. I would say as a digital front door vendor, maybe we're not there yet. Maybe you guys are doing better things than I saw. I haven't been in a hospital in like 10 years, so thank God for that. But anyway, she's also fine. People like to ask that follow-up question. She's doing well. And then finally, post-care. So post-care, I think, is actually the most interesting. I think that's where most of us have been focused in the last couple years, is what do you do when somebody goes home? So how do you keep somebody who's leaving your facility well? What are the types of services you provide someone to keep them well and out of your facility? What do you do with someone that's managing a mid or a long-term condition? What are we looking at for remote monitoring? What are we looking at for preferences? As a patient, is this something they want to be doing more from home? Can we provide them the set of services to take care of themselves at home? And kind of moving from there. And so that's really where we've been investing a lot of our time with personal community in the last year or so, and what we'll be showing off mostly today. So with that, what is personal community? So I'm not sure anyone here knows, so we'll do this for real. It is InterSystems patient engagement platform. So this is a product that serves both our TrackCare and our HealthShare business units. I think we're live in about 13 or 14 countries now, so we have a rather global presence and understanding of patients and healthcare at this point. To date, we've been really focused on providing self-service functionality to existing patients. So it has very firmly put us in kind of that second circle. We've been expanding more out to the fourth circle at this point. For our TrackCare folks, I don't know if anyone here is a TrackCare folk, but if you are, we do build everything fully with complete workflows to TrackCare. So if you're unfamiliar with TrackCare, that's InterSystems International EMR. And I bring that up for our HealthShare customers as well, because what this does allow us to do is build complete closed workflows so that are benefiting the patients. We understand how that fits into a provider or a care team's workflow, and really kind of building a complete workflow between the two parties. And then what we do is we are actually an EMR agnostic product. So everything and any time you hear me kind of reference TrackCare, you can sub that out for the EMR of your choice, your CRM, social care systems, really anywhere that someone's going to be interacting with the patient. And so if we go back to kind of those broader digital front door topics, we can deploy the application one of 3 ways, depending on your strategy. So the application itself can stand on its own. So it can be the centralized entry point for a person to interact with your organization as your digital front door. It can be one in a series of an ecosystem of applications. So if you've already got a appointment scheduling software that you love, Wow, I'm just blanking on things by the end of the week. Other things that you would do that you love. This can kind of complement or augment or sit alongside kind of the series of digital services that you already provide. And you can look to kind of build out just that overarching umbrella layer and kind of tying them all together that way. And then finally, we do provide a complete API access to the product. So should you be going down the road of building a net new user experience, or you want the control of a user experience, everything you've seen here today, you can actually access via APIs, and that way you can take advantage of all of our integrated workflows. So with that, I'm going to switch mostly to demos. So I like to set up just a scenario with my patient that we're going to follow. So in this case, we have Elizabeth. Elizabeth was recently seen. During that visit, there was a concern that she might be pre-diabetic. So she had some additional testing done. So what we're going to see with Personal Community now is Elizabeth is driven to the application because she's been notified that she has a new message. She's just going to simply go ahead, review that message, take a look at the lab results, perhaps interact and ask a question of her provider, and then finally book herself a follow-up visit. All right, so hopefully my video's run. So as I mentioned, Elizabeth goes ahead and is sent a text message. There we go. And she can go ahead and sign into the application. So once here, she's getting kind of a snapshot of where she is at a given point in time. She can see her latest lab results, probably the one that she's going to be asked to review. And she can go ahead and scroll down to see a series of messages that have come to her from the organization. One around invoices, a couple around reviewing lab results, twice apparently. But we're going to focus on this top one where she's being asked to review her recent hemoglobin tests. So here we can see a simple message from her care team asking her to go ahead and review this and perhaps follow up with them if she has any questions or concerns. And as part of this, they've also suggested or told her that they're going to enroll her into a lifestyle management for diabetes wellness program. So in addition to interacting with them right now, we're going to put her on a plan to kind of take care of this moving forward. So she's going to go ahead and check out the lab results itself, heading over to the results section where she can see the latest result, can see a visual indicator and a textual indicator that this value is high. If she wanted to, she could go ahead and download this as well. And while she's here, she can simply scroll down and see other lab results that she has in there. She sees yellow. She's concerned, so she is going to take advantage of following up with her provider. She could go back to messaging. As you would imagine, it's a very standard interaction. She could reply. She could start a new message itself. But then at this point, she's going to recall that they suggested that she just simply book a telehealth visit. And so she's going to go ahead and head over to the appointments section and kind of step through selecting a new appointment for herself. So we'll go ahead and collect some basic information around her insurance. She'll go ahead and select a telehealth visit, as you would imagine. And we'll be able to see the list of available appointments for all providers in the facility that perform telehealth. She has a particular provider that she likes. It's going to be Dr. Elise Edmonds. So she's going to go ahead and filter by her. I'm a little ahead. And then choose a date and time that is most convenient for her. There she goes. I'm not usually ahead of it. Sorry. She has a chance to review. She wants to be clear why she's coming in, so she's going to go ahead and let them know that she wants to review those lab results and confirm the appointment. And so at this point, everything's actually booked, fully booked, and what she's going to do is go ahead and download this to her calendar, because while it's all well and good, and I'd love for her to use Personal Community forever to manage all of her appointments, we want her to actually show up. So being able to get this information into her own personal device is kind of key for her there. Right. And so that kind of wraps that first bit. And then I would imagine nobody is wowed. You expect all of that sort of information and functionality from the application. And that's really kind of where we left off when we were at Global Summit last year. So it's a lot of your standard sort of functionality around being able to view data, interact with your providers, book your own appointments, manage your own care. So what we've got now is Elizabeth on her pre-diabetic journey. And we mentioned that she was going to be enrolled in a wellness program. So at this point, you can imagine that this is an extension. It's another program within the organization, or she's been referred to some other care setting to become part of this wellness program to keep her managing and monitoring her pre-diabetic condition. So at this point, we're going to return back to personal community, where she's going to be asked to complete this wellness registration. And then we're going to follow up with her a little bit of time after that, giving her the option to complete weekly assessments and then be able to track kind of the numbers that she's been gathering about herself. All right. So again, she kind of kicks off with a text message or an email, this time indicating to her that she has new tasks to complete within the application. And so not much will change here, except she's got this presence of a large to-do box, which indicates to her that she has tasks and task items to complete that are related to this lifestyle management for diabetes event or program. Some education, some assessments, and we need her insurance card. So we'll go ahead and start by just filling out an assessment form. So this is just something I made up. You'd have full control over the types of information that you're capturing here. But we're asking her some basic questions that she can fill out and we can submit back as part of her registration. So she'll go ahead, continue to fill this out and submit it. So things like I'm checking them occasionally, we can kind of tailor her care plan or her program based on the answers that she's putting in. At this point, again, they don't know her as well, so we're going to ask for her insurance information. And she's going to go ahead and take a picture of her insurance card. She's been asked to provide a front and a back. We'll just do the front for this. We can see her beautiful insurance card. She take a photo of herself and submit this back into the application. So we can imagine that any sort of uploaded information could be gathered as part of these tasks, and these can be routed back to whoever needs to actually process it. So finally, when this is done, we'll return back to the home page. She can always see what she uploaded at this point by clicking on it. And we'll do the last thing here, which is just some basic education. So we enrolled her in a program. We want to provide some contextual information around what it is we did for her. Very simple, just a link out to the CDC in this case. And so that kind of is going to wrap the first part of Elizabeth's story here. So she's now going to be properly enrolled in here. So at this point, she can see that she's completed her task list, and she'll sign out. If we can imagine now that as part of this program, what she's going to be asked to do is complete a weekly assessment. So every week, she'll get a new text or an email saying that she's got this assessment to complete, and she'll sign back into the application. She will sign back in and have very similar looking weekly assessment or check-in to complete here. So what we're going to do in this case is just to show you some variance in what we can do with the data we're capturing. But we're going to ask her to actually collect, and it is manual, and we'll talk about where we're going with this later. We sent her home with a glucose device, glucometer, that she can kind of be monitoring, capturing information on, and then she'll answer some basic questions about herself. So if we go ahead and start this, she's been doing only okay with her logging. It's not because I was too lazy or wanted you guys to watch me put in multiple dates. She's just not great at logging her information, so we're going to get 2 sets of dates from her. Again, this is me making stuff up. I see confusion, not clinical. Bear with me. She'll enter a second date, and then we're just going to fill out the bottom fast. So what we're doing here is basically giving her the option to start contributing actual clinical data back into her medical record for this piece. We'll fill out her general sort of health questions. Again, you can imagine that depending on her answers here, we may be adjusting the program for her. We might be adjusting what we do next, how we want to intervene. We might need to intervene. And so we really want to be checking in with her on this weekly cadence. So her goal for this week, she's going to try to do better tracking her glucose daily. My team knows I can't type, so daily. And they'll submit that back. So she's been doing this on a regular cadence. We know that we're capturing clinical information. That's going to be flowing back into a system for someone to monitor. But we also want to make sure that Elizabeth can monitor it. If she's collecting her glucose readings at a daily basis, being able to track that, is very useful for her as well. So if she heads back over to our vital signs section, we can see that we have blood glucose taken at home. So a separate sort of collection area to be clear that this is what she's doing, alongside all of the other kind of measurements and observations that have been gathered within all of the participating facilities. Since we've got multiple entries, we've got this icon on the side to view, and she can go ahead and actually see kind of the graph over time, can filter and interact with this as you'd expect, being able to filter this down to perhaps a particular week, being able to kind of hover over particular dates, seeing the values, or optionally kind of scrolling down if she wants to. And that's going to kind of wrap up what she does here. So just as a little bit of a recap of what we're seeing here, what we've introduced is this concept of tasks, or kind of these digital packets that can be sent to a patient, either manually or on some sort of automatic cadence, to capture information from a patient, or simply to inform them about different things that they may want to do with their care. So what about the other side of this? So you can imagine from Elizabeth's perspective first, is she's filling all this out. She wants to make sure that someone's actually doing something with it. There's nothing slightly more frustrating than as a patient to have to come back and have nobody see any of the data that you've been submitting or any of the forms that you've been filling out. So from her perspective, we want to make sure that everyone is properly notified on the other side. But we also want to kind of provide the reverse liability. How does the provider know, or the wellness programmer know, that she's adhering to the program? So we want to make sure that there is a way for them to actually, one, send the assessments and then monitor the status. So is Elizabeth filling them out? If she's not, that allows me time to, again, intervene, or perhaps put her on a different sort of plan. Maybe it's a different communication style for her. And then finally, actually looking at the results that come back. So with this one, I am going to be demonstrating this from TrackCare, but I do want to be clear that pretty much anywhere you're seeing TrackCare here could be your clinical system. Obviously, visuals within TrackCare is TrackCare specific, but the handoffs between the patients and the provider are something that could be done between any system. So just to kind of illustrate what this could look like, what we're going to go ahead and do is start by sending those assessments. So for the purpose of this demonstration, I'm going to send these together as an order set. This is being done manually, but again, especially that that entry in the program could have been triggered automatically based on analytics, based on a referral, and then we can set up that kind of weekly cadence to be an automatic thing as well. So it doesn't need to be a provider coming in and ordering these assessments. So at the point in which we've done these assessments and they've been ordered and they've sent over to Elizabeth, we want to make sure that we're able to monitor that she's filling them out. So from here, we're going to go to what is called the work list in TrackCare. And what we've defined is a task item that somebody can monitor, which is a patient task for a personal community. I'll filter it down, but you can start seeing them here at the bottom, where we can see that there are pending tasks that have been sent to Elizabeth. Come on. Pending tasks that have been sent to Elizabeth for each of the assessments that we sent. So right now, we can start putting this list in front of the care team, the care manager, and they can track whether or not she's actually completing things. So we can see the actual items that were sent, the task items that were sent alongside them, and the actual standings. So here we can see the education is pending, the questionnaire is pending, as well as the insurance card. So we're going to just quickly flip and have Elizabeth complete one of these, just so we can kind of see the interaction that occurs again between the two systems. So if Elizabeth pops back over to personal community, and we won't do all of them again, I won't make you watch the full set of tasks again. But what we'll have now is you can see both of the tasks that she's been at. Simply just going to click on the education. So she has now completed one task on her list. So if we return to TrackCare, what we'll see is that task itself has moved up to an in progress status. So it's got different coloring indicating that Elizabeth has in fact started the task that we asked her to do. And she's completed some of the task items, which you can see by the completed and the date and time. And so that's really useful for just kind of managing and monitoring actions that you're asking patients to do. The last thing I want to show, just to give you an idea of what you could do with some of that clinical data that we're submitting back. So we will have Elizabeth fill out that one form one more time. And I apologize, you'll watch me kind of type that in. In this case, we're just going to add a couple more observation entries to show what we could be doing on the backside when this is done. So not just the ability to see that she's actually completing the task, but having that completion of a task potentially trigger additional workflows within the existing workflow for the team. All right. And I should have cut some of this out. I apologize. Anyway, we'll figure that out, and she'll submit. As you expect, when we go back to TrackCare, this will now be marked as fully completed. And what we can do now, in this case, what I had this do is when any of the assessments are completed, it's triggering a second task, which is to have somebody actually review the assessment. In this case, that's just a simple task that I've created here. But what you could imagine is if we started seeing values go out of range, having more of a clinical alerting scenario or a different sort of notification, and it starts to give you that kind of flexibility around what you want to do with the data that's coming back. So in this case, it's just a simple reviewing of a patient assessment. So that's the one that she just completed there. And so the last thing I'll show here is because we are capturing actual data, so we do have the ability within that form capture to pull out discrete data and submit it back as structured data into, in this case, my EMR. Just an idea of what that could look like. So if we head over to Elizabeth's record, which we should do from the assistant. There we go. We're just going to see that this data is flowing all the way back into the EMR. It's carved out as a specific patient-generated health data so that her providers can see it alongside any of the additional observational data that she's seeing. All right, we just need to I think I can split that one. Okay, so that just kind of wraps where we've been for the last kind of year. So I want to talk through at a higher level some of the feature highlights since the last Global Summit. The first is around conceptually how you use these APIs to drive adoption. So one of the things that's hard to show in a demonstration is this API access. And what we've been doing is building out a series of public-facing APIs that can be used by trusted systems to help drive the adoption of personal community. And then once we've got people enrolled, continuing to use those APIs to drive kind of the stickiness of the application. So what you have here is this concept of defining simply a trigger event. So for Elizabeth, she was placed on the plan. In her case, we were able to, based on that trigger, say she is a personal community user. Therefore, we were able to send that task to her inbox and notify her of it. Alternatively, if she wasn't, so my two guys over here, neither of them are actually currently enrolled, we can have the same trigger. So call him Paul. Paul here in the middle isn't currently enrolled, also is going to qualify for this program. At the point in which we try to send something to him, we recognize that he is not actually enrolled in the application, and we can invite him to enroll. So with personal community, just to roll back a little bit, we have a couple different authentication mechanisms. So we have the ability to leverage third-party or national identity providers. So in the keynote, you saw Francois use Clear. So something like that can be used alongside this application. We've done it with a couple different national providers elsewhere. So this invite works very well with that scenario. So in this case, Paul will get the text message saying, hey, did you know if you use this application, you could fill out and capture kind of all these electronic forms, kind of giving him some sense of why he wants to use the application. And then from there on out, we'd be able to kind of give him more stickiness by driving him back in. My other guy, we'll call him Brian. Alternatively, if we're not using an option that allows a patient to enroll automatically, we don't want to invite them to enroll if they can't enroll themselves. That's kind of mean. Also doesn't drive adoption. So we could, in theory, use our enrollment API to just go ahead and enroll them. So in this case, Brian would just get a notification saying, you've been enrolled in a personal community, perhaps with a customized message saying the reason why. Again, that just kind of gives you a sense of how we can start chaining these up so that all you really have to do is come up with a series of triggers. So instead of every time we're thinking through this, we can kind of put the same pattern in place to say, check if they're a patient. If they're a patient, do the action. If they're not, do one of these alternate scenarios. Then kind of our key highlight from, 2023 is the patient task functionality, and that's kind of why we went through it a couple times. But to talk about this in a little bit more detail, this is a new public facing API. So we saw it used from TrackCare, but this could be used from your CRM, your social care system, really any kind of clinical system of choosing, which can drive a task into personal community for a patient to complete. At this point in time, we support 4 task item types. The first is a document type item. So this is going to be your instructions, your education, could be external links, could be physical documentation that you want to send the patient in regards to that particular task or that particular event. The next 2, from a patient perspective, look identical. And you did actually see both of them. But it's the concept of putting a digital form in front of a patient. So the questionnaire type is for our TrackCare integration. Within TrackCare, you have the availability to create questionnaires. This is a very seamless integration that allows a questionnaire created in TrackCare to be visually rendered for a patient within personal community. And when they submit, it is very similar or the same as submitting the the questionnaire back in TrackCare, which would allow us to then leverage all of the existing functionality around what happens when questionnaires are submitted. So when we did the original assessment in the first task, that's what you saw in that case. The second one, we call it a template, and this is removed from TrackCare. So this is used generally if it's our HealthShare customer or if we need more control over what we're doing with the response. So this allows you to build a form of your choosing as well as what you want to do with the information. So the second task we had when we were actually taking that table of glucose values as well as that additional piece there was using this. And what I had done from a submission perspective was decide that for all of the clinical data I was obtaining up front, I would actually submit that back as discrete data into the EMR. So a little bit more flexibility. Visually, I don't think you noticed a difference. There's technically 2 different task item types. To the patient, they look and perform exactly the same. And then finally, we have the document upload functionality. So that's where we saw her take the photo of her insurance card, but really the ability to capture or collect any sort of physical image documentation that your patient might have that you want to submit back in. 2 things with this. So we can actually route this, again, wherever you'd like. So depending on what you're using for a document or a media store, we can place all that information there as well. And we do also provide a virus scanning framework, since you are allowing your patients who are out there in the world doing whatever they want to upload. We do strongly suggest that you have a virus scanner in place before they upload virus on you. Anyway, yeah, well, controls of not being in a contained environment. Just to give you guys a sense of what this looks like. So for the personal community forms, we've introduced a form builder within the workbench. If anyone here has seen Care Community, this should look very similar. This is the same form building or template builder. They call it a template builder in Care Community that's used in that application. So if you have comfort with one or the other application, you can use this in both of them. That's just my brain dump. That's everything we did since last summit. I would tell people this is the slide you take a photo of if you're currently using personal community, but just, we do a bunch of stuff in a year. And I think at this point, I think I have 10 minutes left, we'll move a little bit on to talk about where we're going. Oh, were you taking it? No, put it back. I put it back. Yeah, it's cool. That's good. Good. I can go back. You can take photos of everything. Sorry. Thank you. All right, so just switching gears slightly to kind of continue where we're going. So what we've been looking at in 2024, I'm going to cover kind of our broader strategy for the application, and then a couple more real specific things that we're actively building or we know we're building by the end of this year. So generally with the product itself, we always have this continued investment in interoperability. So you saw the first set of those APIs that we want to make available. This expands a little bit more to really the other 2 scenarios that we had for deployment models. So we want to make sure that we can be seamlessly embedded into other applications, digital front door strategies that exist, that other applications could be embedded into us if we need to. We didn't talk too much about it, but single sign-on through applications, really ensuring that we can be in an ecosphere of products. And then from a workflow perspective, we want to continue to kind of expand and invest in those areas. So for me, that translates into 2 areas. First is identifying paper-based workflows that still exist, and there are still a lot of organizations with a lot of paper-based workflows, and seeing which ones of those make sense for us to intervene with or digitalize. So one of the things we're going to be doing here, I believe this year, is working with Scotland. A lot of their interactions initially start by mailing the patient a letter, physical letter. So kind of looking at how we can better intervene in there and start moving some of that a little bit more digital. And then finally, automating digital workflows. It's vague. I appreciate that. We're still figuring out what that means, but that's kind of the focus and where we're going, is just continuing to look at the interactions that exist between patients, care teams, providers, what's manual, what requires some overhead from a monitoring or a management perspective, and seeing where we can streamline that between all of the parties involved. When we're looking at the rest of the year, and this does just round out 2024 for us, we are actively working on enhancing some of the messaging capabilities. So we are going to be fronting those with some newer REST APIs to make that easier for other systems to send messages into the patient's inbox. We'll be expanding that to allow for the same sort of update mechanism. So what you saw with the tasks, being able to manage and monitor that someone had a task. If you have a scenario where you need to know whether or not somebody's opened the message, which we have with our letters-based scenario, we can send similar sort of updates back. So if patient hasn't opened the attachment you sent them in X amount of days, you'd be able to act accordingly to whatever your legal or governing standards are in that case. We don't show it in this presentation. There is a somewhat back office piece of personal community. So we are looking at embedding kind of the messaging aspects of that, how they better fit within an EMR or, again, any of these kind of external systems, so we can minimize a clinician or a care team member or an admin having to leave applications. So that kind of fits a little bit with messaging and the interoperability one. Second thing that we're looking at this year is that juncture between dot 1 and dot 2. I have a person that I want to provide services to. They don't exist in my facility yet. What does that need to look like? What information do we need to capture to actually allow themselves to somewhat register with us? It's not really a technical problem. I think that's one that we're just taking a little bit of time on to work through from a business, legal, governing process with some of our customers, but we anticipate that rolling out later this year as well. And then we continue to look at our remote management and monitoring. So the tasks were kind of a good start for this, the concept of these weekly assessments. I did manual capture from a device. Everyone will then ask me, well, when are you doing integrated device stuff? This is where we're kind of making that space to see what happens when you send a device home, what that needs to look like, what other sorts of vendors we might want to partner with in this space. So I will say from my perspective, it's not necessarily a lot of us building bespoke or very focused solutions for certain conditions, but finding kind of the right partners to work with to ensure that we can have kind of a broader solution across there. I have to mention AI. It's been a week full of AI, but we have been doing stuff over the past year that is pretty real that I wanted to talk about. So when I'm looking at patient engagement, AI, machine learning, there's two areas that immediately come to mind for me. The first is our messaging area of the application. I've got two cases there that we'll roll through. And then as a patient-facing front for how we help patients actually understand their data. So I don't know if folks were here or recall last Global Summit, we talked a lot about kind of this message urgency evaluator. So we have one of our customers in Massachusetts. They deal with thousands of messages from patients every day. They're all routed to a call center, and they were getting very concerned that despite the large wording in the application that said, don't send messages for urgent things, that they were actually missing urgent messages. So what we've been working with them on, and we are live with a pilot. We're a couple months in. They've been piloting this with 3 of their facilities now, is we've put in a machine learning model that basically takes the subject and text of a message, runs it through an evaluator to give it an urgency score. Very simply, if the score is above a given threshold, this is actually Cerner. So as I said, we're EMR agnostic. So we're actually routing the messages back over to Cerner. We're just putting a little asterisk, which I know sounds ridiculous. The governing that went into just allowing us to replace an asterisk in there from a machine learning model took about 6 months. But needless to say, what that allows for them to do is these are all kind of pushed to the top of the list. They're the first things that people are looking at. And to just give you a sense of their numbers, so this is at roughly, it's definitely higher than this now, but we've been evaluating 16,000 messages at this point, and that's just 3 of their facilities. So I think they get upwards of, I think we're probably at like 50 or 60,000 messages that they're dealing with, and kind of rolling from there. The other thing that's more of a proof of concept, but just kind of the next steps that make sense here, and this does introduce a little bit of generative AI, summaries, as we've been talking about. So given the large amount of messages, we want to ensure that these are being triaged appropriately, quickly, to the people that can answer them. If it does need a provider, can we get it all out of the call center and into an actual provider's queue faster? So with that, we've been looking at essentially adding a 2-word summary. So very similar at this point, we're just asking for a summary of the message. We're putting that up front, which should help people triage this a little bit faster. I will admit, no timeline on actually doing a pilot here, but that's kind of the natural next step in that progression, which would take us all the way to the last one, which did actually come in the keynote, not us, but I'm glad to hear someone else is doing it too, where you could take this further into the proposed response. So that's just kind of one idea of how we can continue to progress messaging to help deal with the large quantities of messages that folks are dealing with, or helping alleviate the burden of entry for that feature. We do have a lot of sites that just decide not to use it because they're not staffed or they don't want the responsibility for answering, which is a bit of a bummer because patients do really like to communicate. The last thing, yes, I have a chatbot. I think you had to have a chatbot to present this year, so I built a chatbot. But realistically, how do you help a patient understand their data? So this did actually come out in one of the keynotes, if you can remember the first keynote 3 days ago, 2 days ago, whatever day it is. Health literacy is a real thing. So when we're building apps that are facing patients, we're dealing not just with general accessibility, but also ensuring that we're able to provide data at a particular grade level. I actually thought it was 5th grade, so I'm happy it's 6th. I guess it's gone up in a couple years for the US. But at any rate, how do you take then information that you know is not written that way? Like there is nothing that's going to come across in a clinical note that's going to be written at a 5th grade, 6th grade reading level. So this is more just to give folks kind of I'll let you think about it. So being able to, again, use generative AI to say, can I create a medical summary that a patient can understand? Something that is at a particular reading level, something that might be in their native language. I think those are kind of the areas that are worth exploring over the next couple years. Obviously, risk, governance, and all that fun stuff comes into it. But for me, that's kind of a natural progression of what we might be doing here. And the second is maybe not a chatbot, but along those lines. Every patient we've ever interviewed, if they have a question, has told me they go to Google, they go to WebMD, and they just ask their question. So at least in this model, this gives us the ability to have questions being answered about my medical data. So I think that's one way to think about it. If it immediately made you scared to let a patient ask ChatGPT, they are already doing it. This would be an option to get it a little bit more closed circle and potentially trusted. And that, 1 minute over. All right, leaves me at the end of my presentation. So if anyone has any questions, happy to answer them.
So patient tasks, can that trigger a task for another application? So we do a lot of surveys, we do pros and all that sort of stuff for patients on medication, and they have to fill them up with certain intervals.
Yeah.
We act on the responses already based on certain rules.
So could we, for the recording, I will reiterate that question. Can the tasking functionality be expanded to essentially interact with a different application? So we did do a proof of concept earlier this year where we launched an application as a task. So I'd say right now there's nothing that's necessarily in product for it. But to me, it does feel like kind of a natural progression, and it's something we would certainly want to explore with someone. But yeah, that would be useful, I think, in my mind.
Because one of the challenges we have is HCP portal fatigue, so they don't want to
Yeah.
go through a different portal all the time.
Yep.
So having this functionality easy on board patients already on a program in the community.
Yeah, exactly.
And switching them into another community, but maintained by
But maintaining where they are in the sign-on. Yeah. No, I think it makes a lot of sense. It kind of bridges that with our general play for interoperability, where same thing. We just don't want people to have to log in everywhere. Yeah.
And we did the same thing. We only want HCPs to go in the system when they need to. So whenever we analysing blood results or getting adverse event or something like that, it's only those sort of notifications that we're sort of targeting.
Yep. Yeah. Definitely. Jim, I saw your hand go up.
I was curious how you train the model to identify urgent or important tasks. And the second part of the question is, do you ever update that model?
Yeah.
Or is it related?
So we still meet with the customer about every other week. So what we did originally is they had run an initial analysis on their messages on their own, just to see like what was coming in. So like we determined a lot of people were using messages to try to book appointments. Like they did some sort of analysis there. We took about 2,000. I think we took about 2,000 messages, de-identified in-house, and had a small team of internal clinicians review it and kind of flag like which ones they thought was urgent, et cetera. Pass that over to the model, saw how it did. Eventually we had the model versus, I think, a fourth clinician. And they came up pretty close. We've been tweaking it since the pilot, so we're getting a lot of feedback from the folks. It's been predominantly false positives. I think that's the way it is, where it's like, yeah, it's being flagged as urgent, but it's not. And we've made some tweaks past that. But yeah, it's a pretty continuous loop right now for that.
So it's something where you work with customers to train the model. There's not like an operational thing where someone can train the model.
First time we did it, so we were doing it. We're in kind of the handoff where I think they're starting to take over more of that training. I think in an ideal sense, that's how we'd want to do it, but considering it was the first time we did it, we took a lot of it in-house for the starting point.
We do it in-house as well. So we alert on notes, patient notes, adverse events. We have to report adverse events within 24 hours of the notes. So training the model is really getting the nurse to review all the notes.
Yeah, and what we want to do, well, this is where we have the limitation because the messages aren't actually ours because we're in Cerner. It would be able to have it kind of feed back in naturally. We don't have that option in this case, but that would be the ideal, would be having the users as they're going through it, like if they're removing the asterisk, have that indicate to the model that this one wasn't urgent. All right, any other questions for folks? All right, cool. Well, thank you all for coming.